Greetings. Welcome to my YouTube channel. My name is Mushtaq Memon, Professor Emeritus from Washington State University. This video is on bull infertility with the title Navigating Bull Reproductive Health, Insights into Common Disorders. So let us start familiarizing ourselves first with the bull reproductive tract. This picture from Dr. Senger's book shows us there are two testes at the bottom, oval shape, and epididymis is attached to the testes, which is not shown very well here, except the tail of the epididymis, as you can see here, labeled with TE. So after a sperm are produced from the testes, they are transported to the epididymis, and they are stored in the tail of the epididymis before male starts ejaculating. So sperm are then transported from the tail of the epididymis through vas deferens, or ductus deferens, you can see in this picture, and then they come up to close to the accessory sex glands. And in the bull, seminal vesicles or vesicular glands are the primary source of seminal plasma, which is mixed with this these sperm, and then a sperm are coming through the penis and then animal ejaculates. So it's a really overall concept of these different parts of the reproductive tract. It's important to know that, because now when we talk about different problems, you know what we are talking about the location-wise. So let's start with the relatively common condition is the inflammation of the seminal vesicle or seminal vesiculitis. So this is relatively common condition we see in young bulls, and incidence, unfortunately, is not very high, about 2 to 4% in young bulls, and then less than 1% in older bulls. When you have this condition, in a way I do it to insert my hand in the rectum and try to identify the seminal vesicles. They are almost in a similar area as you would find cervix in the cow. So here the location is very similar, but you are feeling different things. So in a normal bull, now I'm able to move those seminal vesicles, whereas when they get vesiculitis or inflammation, they're hard to move. In some chronic cases, they're very hard. And if there's some attachments of adhesions and things like that, it's even worse. So this is a condition which could be, identified, I think, on rectal palpation. And some people suspect this condition when they're looking at the semen they have collected from the bull. When you look under the microscope, you will find a lot of neutrophils. So it makes you wonder where the neutrophils are coming from, which leads you to examination of this bull. Now, there are different causes have been mentioned, including Brucellosis abortus, Actinobacillus pyogenes, and some others. And really don't know for sure what is the cause, but high-energy diet has been suspected. And in prognosis of this situation is kind of questionable in older bulls. So one is better off to cull those bulls, which they are, 8, 9 years old. Whereas, less than 2-year-old bulls, usually they recover on their own if you give them some sexual rest and maybe some antibiotic treatments. I have been involved in a few cases on the surgeries, and they are very complex surgeries, because vesiculitis condition to identify is located right deep in the pelvic inlet, so it's not really successful. Then another relatively common condition is the penile hematoma, or some people call it broken penis. So first of all, we need to identify the location of this enlargement. Hematoma are located proximal to the scrotum. That you could have this enlargement in other parts of the prepuce too, which could be potentially abscess. So first of all, we need to, identify that. Why does it happen? Well, when it's a broken penis, so to speak, so it must be something is broken. So what happens is that you have some blunt trauma and tunica albuginea. The tunic, which is very strong, one ruptures. So blood starts oozing out and accumulates in that one area. So here on this picture, if I could orient you a little bit, as you can see, this enlargement has been cleaned and betadine solution has been applied. But you see on your right-hand side, in the kind of brownish area and the white tape, the testicles have been pushed on one side. And then, as you can see in the front, is the prepuce which has been taped around. So this area is really cleaned. So you need to have general anesthesia and good handling facilities, usually a tilt table where I usually have done these procedures. So the conservative treatment is that you could leave these young animals alone and then give them some antibiotics, sexual rest. Half of them recover on their own. But if it requires some surgery, then we have to, think about cleaning this clot. But it should be done really less than 1 week old tear. So how do you know that? Well, I think the history is the best indication. You ask a client when was the first time you saw the situation, or different things, your pieces put together of the history. And the reason is that you don't want it to wait too long, because then this clot start organizing and you will see quite a bit adhesions in that area. Then it's very difficult to remove the clot. And even if you remove the clot, it's hard to identify the rent or the tear to repair it, because that is the goal in this surgery, to try to go in, cut through the skin and subcu and then to the tunic, and then try to remove this clot. As you can see at the bottom picture, it's pretty messy. So you remove that clot as much as you can, and then, rinse that area, identify the rent, where the tear is, and then try to suture it. So without going into too many details how to do this surgery, I have mentioned 2 very good references at the end. So I would strongly recommend that those of you who are interested, please read those carefully. And then after, if you repair the tunic, keep this animal on antibiotics at least for 5 to 7 days, and requires sexual rest. I mean, this animal should be isolated away from cows at least for 2 to 3 months. Another condition of primarily seen in young bulls is the penile fibropapilloma, or penile wars is called. So this is a virus condition. As you can see here on the hand is that enlargement. This cauliflower type is the end, and the tip of the penis is the glass penis, which is a fairly common location, but these wars could be in the other part of the penis too. So now when this thing happens, this animal is reluctant to mount or even get penis out of his prepuce, because it's painful, and class when note first time maybe some bleeding coming through prepuce. So when animal is not able to get the penis out, to what we call the condition of phimosis, inability of the bull to externalize his penis. So this condition is relatively easy to fix, and as you can see here, this fibropapilloma is located at the mid of the penis there. As you can see at the bottom picture there. If it's a small size, it's easy to externalize, and then, surgically you remove it and then try to close it with cryotherapy, and then give some sexual rest, and, for about a month or so, and most of the animals recover, and keeping this animal away from cows would be a good idea. Other common condition in the young bulls we see is what you call penile hair ring. Now, where the hair come from? Well, The tendency is that when you house young bulls, 2 years or so old together, so they have tendency of homosexuality. They mount on each other. Some of them get in the rectum. Others have tendency to rub their penis on the back of the other bull. And they keep on picking up those hair, and they keep on going in and out, in and out. Pretty soon you have this accumulation of this hair, and they start getting tightened up in this ring. So these animals then are reluctant to breed, and in fact they have a painful situation when the ring is pretty tight. How do you find out? Well, this animal is not able to get the penis out. You can see it very easily when you do the breeding soundness examination. And gently pull this penis out and you will see the ring. It's easy to fix. All you have to do is to, obviously sedate this animal and cut this ring, and then visualize it carefully to see how deep it has gone in. If it's small fistula, then you may be able to just clean it up and then put some antibiotics, ointment, give them some sexual rest, and they recover. If this fistula or the injury or the area is deep, then you may consider other options of maybe cleaning and suturing that area. The last condition I'm going to discuss is the persistent frenulum. This is a connective tissue band between the prepuce and the tip of the penis. And what happens is that after the animal is born, these calves have attachment of the prepuce with the penis, and the attachment releases in about a few weeks, let's say 3 to 4 weeks. But if, you see this animal at, maybe, 5, 6 months of age, and you have some attachment, sometime a gentle pull on the penis, tears this, releases, I should say, this attachment, which is okay. But if you see an animal, let's say after 11, 12 months of age, then probably it's less likely that this attachment is going to be detached. So then you have to think about, removing it manually. Means that, as you can see in this picture here, if you have this tissue band, then you try to ligate that at the bottom and at the top. So that, because always a blood vessel there, and you will have a lot of bleeding on your hand if you don't ligate it. So ligate it, and then you cut in the middle, and you try to put some antibiotics and some ointment on it, and some sexual rest. So these animals usually recover very well. And I've been few of these cases, and luckily they do okay. So these two references I was talking about by Dr. Wolf and Dr. Hopper, they have done an outstanding job explaining these conditions and many more details about it, how to go about and treat these conditions. So I'm not done with bull infertility, and you will enjoy my second video on the other conditions that we will talk about. In the meantime, send me some comments, and if you have any questions, we'll be happy to answer them. In the meantime, I wish you happy time. Thank you. Bye-bye.